Thank you very much for having me. It was a very sad day for our community. Our law enforcement did amazing, as well as our medical staff throughout the entire Genesee County area. Henry Ford Genesis was prepared and did extremely well. We also like to thank Hurley and McLaren for taking great care of all the patients. An update on what we have had is we had a total of 8 patients at Henry Ford Genesis from the ages of 6 to 78. 5 were gunshot wounds and 3 were smoke inhalations. 2 of the smoke inhalations have been discharged. 1 is still intubated at this time. For the gunshot wounds, 1 had sustained gunshot wounds, multiple to the chest and abdomen, is in critical condition. 1 had to the abdomen, as in critical condition still, but mostly stable. 1 of the victims did die in the emergency department. 1 child came in, was stabilized, and then transferred. And then there was another gentleman who had a gunshot on the leg. The trauma team was really well prepared for this. They activated the Mass Casualty Incident Command. Our trauma surgeon, Christopher Ash, was on the team, and John Vance, one of our other trauma surgeons, helped lead the charge. Dr. Sandy Ross was the ER attending at the time and did a phenomenal job of triaging. All of the community members came together. We hate having to prepare for these kind of events, but we are prepared, as well as the other hospitals in our community. We're very grateful to be helping to serve this community, and will continue to do for years to come. So, any questions?
How many were under the age of 18? What round struck the victims? You said some were shot in the chest and abdomen. Was this with rifle, 223 round handgun? Can you speak?
I don't have information on the caliber.
How many were under the age of 18?
I don't have that answer either.
What was the age range again?
It was 6 to 78.
Of the people found in the church after it was evacuated, do you know anything about the suspected cause of death of those 2 people?
I do not, and I can't extrapolate either.
Can you tell us more about the child that you mentioned? Was that child shot, boy or girl, 6-year-old?
Had an injury to the arm, and out of an abundance of caution was transferred to another hospital.
Was the injury a gunshot wound to the arm?
I can't verify that.
Dr. Danic was one of the physicians that was treating patients yesterday. If anybody wants to ask him about his experience and just being there.
I will say it was very interesting taking care of our community members in this kind of a traumatic experience. We had a number of our residents who were members of the church and were on site. Not only were they victims, they were also first responders. And having your friends and family come in injured and taking care of them is a really incredible experience. They were heroes. Those on the scene were absolute heroes, going in and out of the fire to drag people out, helping each other take care of the victims on the scene. And the community really came together.
As a local station, I wanted to ask, you know, have you ever seen anything even like to this extent in our community, and what was that like for you to respond to?
Never in our community. A lot of us who have trained in the trauma settings have dealt with gunshot wounds, so everyone who's on the staff there has dealt with these types of injuries in the past. It's just strange when it's your community hospital.
Last question.
I understand there were some nurses that were on strike and wanted to help and returned away. Are you able to talk a little bit about that?
Yeah, we're very happy that the instinct was to help. And we have a great loving community, and the instinct was there, but I cannot comment on the work stoppage.
All right, thank you.
Sorry, doctor, just quickly, when you said residents, you meant residents in the community, right?
Resident physicians, those
Resident
in training.
Okay. Thank you.
Thank you. All right, thank you.